I'm Amanda Starantino. We're joined with Dr. Gallagher from IU Health. She's the director of the Gender Affirmation Surgery Program. And this program just started in 2015. So how did you get into it? Because you didn't start doing these surgeries till
right until later. So I went into plastic surgery because I love making things look good. However, I wasn't really sure if I wanted to do a cosmetic practice per se. So I was quite a bit into my training. I was already about 8 or 9 years out of medical school by the time I discovered this field. And really, I instantly fell in love with the field for two reasons. So first of all, these surgeries are so important to patients. It obviously goes way beyond vanity. And many of my patients would describe these surgeries as life-saving. So that was one of the things that attracted me to it. And then up until then, I didn't really in my personal life know many folks who were transgender. And really, I kind of fell in love with working with this patient population. It takes a lot of bravery to be authentic and come out as transgender. Even in 2019 in the United States, it is still tough being transgender. And you know, I think we can all relate to the bravery these patients have in being able to be their authentic selves. You know, I think if I was growing up, I'm not sure I would have had that bravery to come out. It's never easy. So I've definitely loved working with the population, and this is absolutely the most meaningful work I've ever done. So it's pretty much my dream practice, and you know, I look forward to doing these surgeries every day. Unlike a lot of other things in medicine which are about disease and pain, these surgeries, patients count down the days for these surgeries. They look forward to it. They've worked years in many cases to undergo these procedures, and you know, that'll get you out of bed every morning to come
and it gives them a new outlook on life.
Absolutely, yeah.
That's amazing. And we were discussing how when you started this program, this wasn't a big topic before, and so for medical professionals, it wasn't something that everyone was used to either. So how was that transition when you began that?
Yeah, so a lot of my training was done in, shall we say, maybe more liberal locations, and I was a little bit worried maybe what the reaction might be amongst staff. And so what we did was we did a lot of training and education amongst the staff, and oftentimes members of the transgender community came and did some education, and really very quickly our staff, and particularly the nurses, have become great patient advocates, and I'm really heartened by that. They love working with this patient population, and a lot of nurses and OR team will request to work with us, you know, to be involved in this field because, you know, it's such meaningful work, and for the most part, most of the staff have loved taking care of this patient population.
How does the process begin when someone decides they want to have surgery? Do they just contact their insurance company, or kind of where do you even begin with this?
Okay, so usually by the time somebody's ready for gender affirmation surgery, they tend to be quite far already into their transition. And oftentimes, for example, with the genital surgeries, in order to be able to undergo the surgery, the patient has already been on hormones for at least a year, living in their gender identity for at least a year. So typically, patients will already be quite involved in the community and will be set up with mental health before they come and see us. In order to get insurance to cover their surgery, they will need to be seen by mental health, and will need to have documentation from one, sometimes two, or maybe even more mental health professionals that surgery is right for them.
Okay, so what kind of age do you usually see coming into your office when it's time for surgery?
Yeah, so there can be a vast range. It can really be any age, and we've operated from late teens in certain circumstances right through to, I think our oldest patient was actually 72.
Wow.
So as long as a patient is fit and healthy enough to undergo their surgery, there's really not any hard and fast limits for the mature patients to undergo their surgery. So in general, however, we tend to see patients who'll come in early 20s, oftentimes with their family, or maybe later on in life when For some reason, oftentimes a life event will trigger something in that patient, be it a divorce or the death of a parent or something like that, and a patient will decide at that point to come out as transgender and undergo their surgery.
Interesting. Okay. So part of it, when we're doing this series, you had talked about that they have to go see a mental health professional for a certain amount of time before they can have their surgery. Why is that?
So what we obviously, you know, first of all, as a doctor, you want to do no harm. So we have to make sure, obviously, these are oftentimes irreversible surgeries and life-changing surgeries. And obviously, we have to make sure that the patient is, one, ready psychologically for the surgery. So they have to be mentally as well as physically fit and well enough to undergo the surgery. And also, we have to make sure that we have the diagnosis right, that the patient does indeed have gender dysphoria, and this is the right treatment for them. So we never take these surgeries lightly, and in undergoing screening by one or more mental health professionals, we're able to avoid regret very well. Gotcha. So the rates of regret tend to be very low in patients.
All right. So now when I had first met you, you said you started the program at IU Health for the gender affirmation surgery program in 2015, and you only had 2 patients that year.
Yeah.
Okay,
yeah.
And it's grown to a huge amount.
It has.
Talk about that growth.
Yeah. So a couple of reasons for that growth. One would be being transgender and having gender dysphoria seems to be way more common than we ever knew. So when I was in medical school, we were taught that being transgender was pretty rare, and it seems we probably got that wrong. In fact, when we look at populations where patients self-identify, so we ask an entire population who identifies as transgender, we're seeing that number closer to between 6 in 1,000 and actually 1.5%, so a lot more common than we ever thought. And so for that reason, it's more common. The other thing is that patients now more than ever before have access to care. So about 70% of privately insured patients will be able to get their surgeries. So for those 2 reasons, we've seen massive growth in the program in that we get about 85 to 90 referrals a month.
And something we had talked about in part 1 of our series that we did, the American Medical Association deemed these medically necessary procedures. Can you kind of talk about how that decision was made and how that made an impact?
Yeah. So obviously, as medical professionals, we have to be evidence-based. And so what we have to do is look at the data, and probably something that the medical profession got wrong a long time ago was not understanding gender dysphoria and what it was to being transgender. And there was a time where people thought if you were transgender, that was a mental illness, and that you had to be somehow convinced that your identity had to fit the body into which you were born. Now we understand that that just doesn't work. And the better treatment for patients with gender dysphoria is to in fact change the body through medical or surgical means, wherever appropriate, to fit the patient's gender identity. So really this concept of gender identity has become the most important thing which we now understand. And as such, since 2011, the American Medical Association have understood that this is a serious medical condition. And by serious medical condition, unfortunately, if it's not treated appropriately, patients do have a high suicide rate. So many of my patients would you know, certainly consider, well, we consider this medically necessary procedures. Insurance companies now consider it medically necessary procedures, and our patients, you know, consider it life-saving in many cases.
So a lot of questions I got when doing this story is a lot of people didn't understand the difference between sexual orientation and gender identity, and they're completely different things.
Absolutely. So they can be very confusing for folks. So your sexual orientation is who you're attracted to, and your gender identity is who you identify as, what gender you identify as. So, you know, as one of my patients put it, sexual orientation is who you go to bed with, gender identity is who you go to bed as. So very different things.
Okay, that's one way to put it. A little bit easier to understand. Cool. All right, do you need to take a breather or anything? You're doing good. You're good. Cool. So we'll just keep going then. So I think another concept is we've been talking about gender dysphoria, and we never really got a chance to really explain what it was. So can you talk about gender dysphoria and the impact it can have on that person?
So gender dysphoria is a serious medical condition. That is that profound sadness and discomfort a patient will have when they're assigned a gender at birth with which they don't identify with. And many patients who are transgender will have this profound gender dysphoria, which in some cases can lead to suicide attempts, and depending on which study you read, that can be 40 to 50%. So we understand that this is a serious medical condition, and we also now understand that the treatment for this is to change the body to fit the patient's gender identity, and that gender identity is the most important factor.
Okay, so in the time you've done transgender surgery, so it's been about almost 5 years now, so are you seeing more female to male, male to female? What's kind of a trend that you see more of?
Okay.
Or is it even?
Yeah, I honestly believe that it's probably about even. If you look at the literature, there was a thought at one point that male to female patients were more common. Certainly in our practice, we're probably seeing about even numbers. And it may be that once a patient goes on testosterone, if they choose to do so, and they grow in a beard, you know, they pass very well in society. So it may well be that many transgender folks are passing, particularly the men are passing as transgender men, and therefore, you know, may not want to traditionally in the past have outed themselves. They choose to pass instead. So I think maybe that's where that statistic came from, but certainly within our practice we're seeing pretty even numbers.
Okay. So we interviewed Ryan, and he had talked about that he had more of a gender dysphoria for his top half, and the bottom half wasn't really even an issue for him at this time. Do you see that more often? And you had mentioned you do a lot of top half surgeries.
Yeah, we certainly do. Top surgery for transgender men is a very nice procedure. It's a 2-hour procedure. It's a life-changing procedure with few complications, and for that reason, probably more transgender men seek out that procedure as opposed to the bottom surgery, which is a little bit more complicated. It usually has to be done in several steps. And really, one of the most important things my patients have taught me is you can't make any assumptions. You know, just every patient is an individual. Some patients may not even ever need surgery for their affirmation. They may do fine with hormones, or even maybe without. So, you know, certainly one thing the transgender patient population has taught me is patient-centered care. So it depends, I would say, very much so in the individual, and it just depends on what that individual needs. And one thing I do know is when a patient comes to see me, these are very well thought out decisions that have been discussed at length, usually with the help of one or maybe more mental health professionals.
So I think a lot of questions I got from people was, when you do these surgeries, we see things happening on the outside, especially with you doing plastics. But how does that affect the interior and what's going on in there?
Well, so our patients definitely anecdotally will describe alterations in their lives. Patient satisfaction is very high, but again, what are we trying to treat here? We're trying to treat gender dysphoria, which is a difficult thing to measure. And certainly being transgender, you know, particularly in certain societies where acceptance isn't great, it's still very difficult. So I would say not every patient is necessarily cured by gender affirmation surgery, but we know it certainly helps. And as a medical professional, or as the medical profession treat gender dysphoria, these are the treatments we know that work.
So I want to talk about the fact that you've created a whole community, and you have a lot of following on Instagram and a little bit on Facebook too, and so you're out there, and so people are feeling comfortable showing that what's happening. Kind of talk about the growth of that and how it all started even.
Well, so I have to say, one thing I really admire about my patients is, you know, first of all, unfortunately in the United States in this day and age, it's still not easy being transgender. You know, there's a lot of miseducation, misunderstanding out there, and you know, in rural communities, which is probably where most of my patients come from, it's very difficult. So one thing I've seen our patients doing is they really become ambassadors for the community, and I really admire amongst our patients, we see so much bravery. These guys and girls are proud of their identity. Oftentimes, you know, they've been through this, they've come out to themselves, their community, their family. There are some sad stories, but you know, they've lived through that and they're proud, they're transgender, and they want to share their stories. So one thing that really makes my day constantly is at the end of a long hard day when I come home and I see one of my patients might have tagged me in a picture on Instagram. Particularly this time of year, we see all the shirtless selfies begin to come out, and you know, it just really warms your heart, because when we look at the transgender men, for example, who've had top surgery, they're in the pool, they're with their families, they're just getting on with their lives, they're comfortable in their bodies, and you know, really it warms my heart to see that. And also, you know, the community obviously like to see those pictures too, and so we've developed a little bit of a following on Instagram and YouTube as well as
That's great.
Facebook.
Yeah, a lot of being made with that to broaden those communities. And so where can people follow you at?
So I have Instagram at Dr. Gallagher, as well as YouTube again at Dr. Gallagher, and Facebook at Dr. Gallagher.
So if people have any questions for you, are they free to reach out on those platforms?
Yep.
Cool. Let's see. So something I really liked when I was going through your interview that we did months ago was you were talking about kind of, it's like the satisfaction at the end of the surgeries and how you see them walk away. And I really love the way you described that. So oftentimes, you know, we see that pride a patient has, particularly the transgender men, who become very comfortable in their bodies, and you know, so we always, you know, typical in plastic surgery, we'll, you know, monitor outcomes very carefully and take pictures, before and after pictures, and we'll obviously have them take their shirts off to take their after pictures, and you know, sometimes they don't want to put their shirts back on again. You know, they're very proud and they stand differently, and you know, that gives me so much satisfaction, you know, to see that. Cool. So what kind of support do you see locally to help patients in this program?
So when I came into Indy to start these surgeries in 2015, I really met a lot of great folks who are already providing care and excellent care for the transgender community. And just the piece we were missing was the gender affirmation surgery, which is what our program brought. But there are great resources out there for folks. There are some really good primary care doctors, mental health professionals. We have organizations such as the Indiana Youth Group, Gender Nexus, Eskenazi Transgender Health and Wellness Clinic. So there are plenty of good resources out there for patients who are maybe beginning to explore gender identity issues.
Okay. You're on Instagram, on YouTube, on Facebook. Where can people follow you?
Yeah, so my name on Instagram is probably our most popular platform because we have a lot of patient photographs on there. And so that's Dr. Gallagher, so my first name and last name. We also have YouTube, again, Dr. Gallagher, and Facebook, my name again.
All right, and we will have all of those on the RTV6 website. So if you want to learn more about this program, see the stories that we've done on one of your patients who took us through the whole process and his beautiful story and where he's at now, you can find all of that at RTV6 website. That's the indychannel.com, and you can also find where Dr. Gallagher is at too online. So thank you for joining us.
Thank you.